Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we're here with Christy today, who has played professional women's basketball for how many years?
2 years.
2 years, yeah. And she's with us now because she had some problems in her low back and pelvis from some previous sports injuries. But here recently, she has herniated the disc down in her L5-S1, a full 10 millimeters. The interesting thing about this case is that she doesn't have any of the positive orthopedic neurological tests for a lumbar disc herniation. Hers seems to be more down in the sacral and coccygeal regions and sacroiliac regions of her pelvis. So we're going to show you how we're going to analyze her and treat her today. And we broke the pin off when decompressing a patient the other day. So we're going to do this today without any pins and show you that we can still get decompression. I think there was a chiropractor that made a comment on one of our videos not long ago about what's the difference between your spinal decompression and a crane condyle lift. Well, basically we're doing a crane condyle lift but bilaterally, and we get a lot more decompression of the entire spine doing that rather than just your thumb on the occipital region there in the condyle. So, okay, Chris, just take a look at your posture here first. Okay, let's have you flex your head forward and then backwards and then neutral. Yeah, so she's got just a little bit of forward head posture. Not bad though, it's much improved from what it used to be. And that's one of the reasons we increased the weight bearing load down here, is when you got your head forward even a quarter to half an inch, it increases the load bearing on your spine because of all the levers involved. Okay, and she got a little bit of right rotation of her head. That's probably the way she's sleeping most of the time. And a little bit of an elevation on the left side of her pelvis. And her translation is a little bit to the right down in her pelvis. So, okay, Chris, just have you go ahead and lay on your back here like I was going to pin you in. I'm used to reaching for the pin. Now, this will be the first time I've actually done this on her without the pins. She was a little nervous about that when she first came in today, but there we go. Okay.
Dr. Johnson?
Yes.
Her legs.
Oh, yeah, for your leg. Yeah, flat right there. You go. So, again, what you do is you just get a traction, take a deep breath through your nose, let it all the way out. There we go. One more here today. There. Okay. Now, how far down did you feel that, Christy?
All the way down into my
All the way
right
down
glute.
to your right glute? Okay. So that's into her sacroiliac. So see, that's where a lot of her issues are coming from. But you can still get decompression with just the weight of the body holding it down if you get a good firm pull on the y-axis vertically. Okay, good. Let's come over here on your tummy now, sideways down. Okay, now I'm going to put your headpiece forward. Remember, have your head all the way up in here for me and down. Now, her right leg is about a half an inch shorter than her left leg today, and you can actually see her right pelvis sticking up more, and I bet you that tightens up already in your pelvis, doesn't it? Yep. Okay, so you can actually see the right SI joint is elevated over top of this left one. So we're going to adjust the right sacroiliac joint first in a X to Y drive. And get my table stiff. There we go. Good. And then her sacrum on the right side. Her sacrum in the center. Sacrum on the left part, and now her left SI joint. There we go. Actually, I'm going to get over here and adjust her right SI joint like this too. Okay. Sometimes my table has a hard time staying on some of these. There we go. That was it. Okay, now we're going to reevaluate her leg length, which is exactly even now. And Christy, tell me if this feels any easier than the first one. Okay, good. So, you know, here's the L5-S1 disc right here. Really, you're getting most of your stuff coming from right out of here, though, aren't you? So what we've been doing is really working on the gluteus medius, gluteus maximus, and piriformis muscles, which are the paraspinal musculature of her sacroiliac joints. The piriformis goes from the actual hip to the sacrum. It's what it's the muscle that's utilized whenever you have internal and external rotation of the pelvis with the leg. There's some really good stretches for that too, but we're just getting in here and applying some deep pressure. Plus we referred her over to Clay Hennard here in Houston, who is our professional medical massage therapist that we work with. He refers us all his difficult cases, and we refer him anybody that needs a soft tissue, deep tissue medical massage, not just a rubby feel good. And as you can tell, these aren't rubby feel goods either. It's not a rubby feel good, is it, Christy? Yeah. This is one of those ones that does hurt so good, though. Because when we're done with this, it feels better. So I get that elbow planted right in the knots or the trigger points that develop right to the side of the spine, which are the paraspinal muscles, which, by the way, are 4 layers deep from the skull all the way down to the sacrum. Yeah, and you got to really kind of go in rhythm with the patient's breathing and push extra deep and hard when they get to exhaling. Yeah, really work with them. Yeah, now she's got some compensatory tightness up in the thoracolumbar region here. Okay, so now the L5S1 disc is the actual one on the MRI that shows the 10 millimeter disc herniation. There we go. But she's not showing a significant amount of spinal canal stenosis. So we're able to do these P to A adjustments in the Z-axis without